Hello everyone. As a palliative care giver, you have come to a family where the patient is chronically ill and he had some life left in his life, maybe lifespan, maybe 2 months, 4 months, or a year when the doctors have given the final verdict that the patient is not going to survive more than 6 months. But the family needs that he should be uh, happy, he should be comfortable as long as he is alive. So in that journey of life, the end part is very, very pathetic, very crucial. Because everybody watches from very close that the patient is suffering. In spite of all efforts, he is not getting cured. Pain is not manageable. He is crying whole day and night. So any loved one will never like this situation. But as a palliative care giver, we do our best to get rid of from these symptoms. But even then, we fail to do most of the time. So earlier class I told you that euthanasia is one way, but 99% people in the society never go for that. That is a very drastic step. Nobody takes it. So patient dies with pain in the home. And we are the witness. As a palliative care giver, you are the witness. Family members, of course, they are the witness. But what happens if the patient dies? What is the condition of the family? What is the condition of the friends, relatives, in society? That is also very important. Your job is not completed when the patient has died. Your job is still there to console the family members that they should return to the normal mental state and they should start doing their daily routine, what they were doing in their life. So your job is to take care of the patient and also to take care of the family. So today I am going to talk post-death, शोक, ग्लानि, दुख जो होता है पेशेंट में, पेशेंट की फैमिली में, उसको कैसे मैनेज करें. And the one part of the whole talk is the Hindu rituals. In the Sanatan Dharma we do Terahi, in our Samaj we do the 4 days activity. In different religions there are different methods of doing, but I don't know much about other religions. I know about the Sanatan Dharma, so I will talk about that. You can educate yourself for other religions, what kind of patient is there, what family, what culture, what belief they have, accordingly you can do it. But I will talk about Hindu religion. The grief and emotional weight. Today's topic is about exploring the grief before and after death. Grief of the family. It is lived experience, one that you as a caregiver will witness intimately in the family you will serve, and sometimes even when within yourself. The family is witnessing and you are also witnessing. We must acknowledge the emotional weight of this topic. And very important, how much grief is there in the patient. Accordingly, you will manage. So how to measure the grief, that is also a very important part. Our goal to address the grief before and after death. Our goal is not to solve the grief. Grief you cannot solve. You can live with the grief and dilute it. We are not here to make it disappear. Instead, we will learn to understand it, understand the grief, walk beside it, walk with family under that grief and support the family. This is your goal, okay? Because a parent of a family has gone away. They are naturally in the grief. You cannot reduce the grief. You cannot bring back his father or mother in the family. But the grief which the children are facing, you can dilute it by talking to them, by discussing the future plan of activities. So mind will be diverted. How you reduce the grief? By diverting the mind of the family member from that episode to other activities. And that is the main thing what in our Terahi rituals, 13 days rituals, it is done. We divert the mind of the aggrieved family from that episode of death which they have seen to other activities. The mind is the same. If the mind is involved in other activity, grief will disappear. It is automatic, no problem. We will also explore the difference between what we know in theory, there is a theory of grief, and what really happens when a family breaks up. Theoretical knowledge everybody has, but the practical situation you have to face. So that's why you should be ready for the practical knowledge and practical application. That is important. Your knowledge and lived experience give strength to the family. And as a palliative care worker, you take it forward. So now understand the grief and bereavement. Bereavement means शोक. जो शोक आपको होता है, दुख होता है, दुख और दर्द कहते हैं हम लोग, यही है grief and bereavement. Type of grief. Now one is the normal, anticipatory, and complicated. Other is disenfranchised, suicide and miscarriage. If patient is dying because of disease, you know that you anticipate this grief will come. But if man suicides in your family, you were not knowing. One morning you saw he is hanging, he has taken poison, he has died. That kind of grief is different, a sudden grief, and one is the gradual. Theory of grief. Kubler-Ross theory, Warden's task theory, dual process. They are the theory given by the psychologist. Okay. Grief before death, anticipatory, that is anticipatory grief. Common in long-term illness. Family may feel guilt, helplessness, risk of caregiver burnout. Because of you have given service for a long time, you may get a burnout. Stress is there. Description, the 5 stages. In the Kubler-Ross is the 5 stages: denial, anger, bargaining, depression, and acceptance. This is the Kubler-Ross model, there are 5. In the Warden's task, the 4 tasks: accept, process, adjust, and reinvest. And this dual process, oscillating between loss and restoration oriented coping. This is the theory. Grief after death. This is the grief before death. You have anticipated. Grief after death. Marooning rituals vary culturally. In different cultures, there are different methods of rituals, marooning rituals. Emotional expression versus suppression. You may start crying, but you may keep silent, but get agony within yourself. Emotional expression versus suppression. You are expressing and you are suppressing within yourself. Suppression is bad, expression is better. And need for community support. Community has to support the family in this grief after death. The signs of complicated grief. This is a complicated grief, okay? This is anticipatory, I have told you, and accidental, I have told you, suicide and murder. And now the signs last more than 6 months. Functional impairment, suicidal thoughts, anger and guilt. These are the complicated grief family member find these kind of symptoms. He should be consulted to the psychologist and the psychiatrist. When and how to intervene. Grief assessment scale. You should assess the level of grief in the patient. Family meetings and memory work. 3 things. Grief assessment. Identify a risk of complicated grief. Earlier I have told you the complicated grief lasts more than 6 months, functional impairment, suicide thought, anger and guilt. So you should assess the risk of complicated grief. And then use during final week and 1 month post-death. Last week of the death and 1 month post-death is the grief assessment scale. Family meeting, emotional and practical support. Schedule regular and post-death meetings. And memory work, legacy making. letters and boxes. Encourage creative ways for closure. This legacy making letters and boxes. The stages of terminal illness and trajectory. Decline patient pattern in cancer, organ failure, dementia, signs of approaching death. The Aris Lakshana, I told you in the earlier class, the Ayurveda is given Aris Lakshana. If Aris Lakshana is appearing, then you can get ready that the patient is going to die. Communication with the patient and family. Breaking bad news. Use the SPIKE protocol, SPIKE, I have told you several times. I will tell again. And active listening. Listen peacefully about the aggrieved family, what they are saying. Turn truth telling versus hope. Tell the truth. Role of palliative care team. Interdisciplinary collaboration. Establish an interdisciplinary collaboration with all team members. Communication skills should be very good, like SPIKE, nurse, reliever. There are some models, validated models, which you can apply for communication. And culturally sensitive, depending on the culture from which the patient and patient family is, they develop that kind of application. So practical counseling skill. Active listening, I told you, body language, silence and empathy. And avoid judgmental language. Understand cultural and spiritual dimensions. Rituals around death, respecting belief, and language and non-verbal cues. These are the things you have to understand. Visualize and the family dynamics. Who is the primary caregiver in the family? Take care of him, because he is the most aggrieved person. Sibling conflicts, parental guilt, empower family roles, and dealing with guilt, blame, and anger. Once a man dies, people start blaming somebody because of the doctor, because of that nurse, because of that person. My parents have died, my father has died. So normalize emotions. But now there is no point in discussing all these issues. So normalize that emotions of the family. Offer validation. Refer if symptoms persist. And lastly, supporting children. If the children are in the family, teenagers are there, use age-appropriate language, art, play therapy, reassurance, and structure. For the adult people, these are the approaches. For children in the family, because they don't know what has happened to their grandfather, so engage them for other kind of activities. The common tools which are used for the grief support. Tools are the dignity therapy, reminiscence, and very variant risk index measurement. What it does, dignity therapy, life review interview. This is it. End of the life phase. Reminiscence, memory sharing, family session, group. Call the family sessions and memory sharing. Do it. Very variant, predict the poor coping. Stage of grief. Predict. Use at the time of diagnosis and post-death. Psychological support, normalized versus pathological grief. Refers to psychologist when needed. Psychological support. Group intervention, I told you. Peer grief support group. Family workshops. Confidentiality guidelines. This is the group intervention. Self-care of professionals. You as a caregiver, you are also a part of that family. You are also sad because the patient has died. You were living with him for a month or 6 months. Now you are also sad. So secondary trauma, burnout signs, support group and reflective journaling. This part you have to do to maintain your health. Post-death protocol, actions and tools. Now, call family for 24 to 48 hours after death. Offer memory rituals. Follow up at 1 week and 1 month. This is the action you have to take. Acknowledge the grief. Call them and acknowledge the grief by patient listening. And closure, memory rituals, closure. And monitor grief progression. Follow up. Talk to them weekly or up to a month, and follow up, the grief will come down. If needed, use referral. If you find that the patient, the grief is not coming down, he is still in conflict of decision, then call a referral. When to involve a psychologist or psychiatrist for the patient, family care. Coordination with religious and community leaders. This is also your job. So these are the nurse and spikes. These are the tools which can be used to manage the grief of the family. Nurse means name, understand, respect, support, and explore. NURSE. NURSE. Use when acknowledging emotions. This is the use of nurse. Spike, delivering bad news. If you have to deliver a bad news, use the spike tool. Follow order strictly for calmness. You have to follow. The ethical and legal aspect. Informed consent and autonomy. Patient versus family decision. Legal representative understanding. Ethical dilemma, withdrawal of care, conflict between family wishes and medical judgment. Death certificate, documentations and support. Factual and compensate documentation. Provide next step to family. These are the things which you can arrange for your family, the ethical and legal aspect, so that they can get rid of from these problems and devote themselves to their day-to-day work and get rid of the grief which they have faced because of the death. Real-world application and practices. Make a grief response plan. Case 1. Anticipatory grief. Elderly patient in terminal stage. Role play of family meeting. Case 2. Sudden death in young adult. Because of some accident has taken place. A young adult has died. Handling shock, anger and pain. Interdisciplinary response. Steps. Identify a high-risk family. Develop care timeline. Assign roles. Example, based on history and dynamic. Timeline with counseling checkpoints. Timeline. And assign roles, nurse, counselors, and spiritual guides. They can be deployed in family for that. You need to apply spikes delivery, group sharing on experience. I told you this is the spike sharing, this is the nurse method. You have to apply spike sharing. Now, I told you the Berry-Bement risk index. What is this? You should know. This is helpful in understanding the level of the family is facing. It is a structured questionnaire to evaluate the likelihood that a delivered person will experience poor psychological outcome such as complicated grief, depression, or social dysfunction. What are these questions? Personal history, past trauma, history, and depression or anxiety. Relationship with the deceased who has died, dependency, unresolved conflicts, circumstances of death, sudden, traumatic, or violent death. Social support means isolation, lack of emotional support, and coping ability, poor coping skills, rigidity. It helps in identifying those who need closer follow-up or counseling. Prioritize limited resources for high-risk families. Facilitates early intervention before grief becomes pathological. So this is the index which will help in prioritizing the resources for the high-risk family and early intervention management. So application of validated tools in real life family. Spike, I told you, a nurse, I'm going to talk. What is spike? You see, SPIKES. After the death, use spike structure to approach family. Sit with them quietly in private. Ask about their current understanding. P. I means give Space for emotions. K. Explain death in sensitive spiritual language. Key. Address emotions using nerves. Thus is this, I will tell you. Address emotions and support rituals. Terehi, Katha as part of the closure. So this is the spike tool which you should apply to the family after death. And here I use the word nerves for addressing the emotions. How? Nerves means you are feeling overwhelmed with so many rituals. You understand. These days are not just duty, they are your way to grieving. Respect. It is powerful how your family is keeping his memory alive. Support. I am here if you want to talk within the puja and the gathering and explore what does today's katha make you reflect on about your loved ones. This is the method of talking to address the emotion of the agreed family. In the Hindu rituals, now I am giving you a lead how the Hindu rituals have been followed, are being followed, and how they are connected with the modern. This is the modern method, application of validated tools, and this is the traditional method which I am going to talk. But this traditional method can be compared with the modern method. This is the kind of validation of our traditional knowledge. You know, traditions are very strong, they are very rich, and they are very scientific also. Since we are not knowing their importance, we are just following because our ancestors have done it. But now, with the reasoning power, people ask why we should do. So that answer will come from science, from objective parameters. And this is what I am going to talk. Spiritual ritual significance. Daily tree rituals. People and banyan tree, they put a ghada on a tree, and every day morning, the main person who has given the agni to the dead body on the Ashmashan Ghat, he goes and put water in that, and with him all the family, male family members also go. And they go in the group, they keep on talking with each other, and they do an activity. What I mean, a grieved family is involved in an activity, everyday activity. In the morning, putting water in the ghada, in the evening, putting a lamp near there. And that ghada is placed outside your house, somewhere in a tree. So you have to walk a little bit to do this job. Every day, for up to 9 days, water pour, hung morning, sustains the soul. Lamp lit evening guides the soul. Because soul is alive. Man is dead, but soul is alive. You are now worshipping the soul. You are now taking care of the soul. 10th day, head shaving by males. Symbol of detachment, grief, and humanity. Everybody in the family shaves their head, all the hairs is out. This shows a kind of detachment with the worldly things, because hair is a part of your beautification. You are beautiful look because you have a hair. You always do good dressing, but now you are getting rid of it in the memory of that person who has passed away. This shows a symbol of detachment, grief, and humanity. 11th and 12th day offering Shraddha, because the Shraddha Puja is done. Its item loved by a deceased are offered to Mahapatra Brahman who comes to visit during this puja, 11th and 12th day. Mahapatra is a special type of Brahmins who receive the donations while death Shraddha Puja is done. It ensures peace and nourishment of the soul. The soul is alive. The soul is there in the ghada, and you have done for all the 10 days that worship of the ghada, and now 11th and 12th days you are giving a donation to Mahapatra in the name of that soul. And what donation you give? The idea is, what are the likings and disliking of the dead person? The liking things should be given. Suppose he is a likeness of sweet, so sweet is given. He is a likeness of some spicy food. The spicy food is made and given. Something like that, just to memorize that, look, and the soul is there. He is watching what I am doing. This kind of feeling is present in the Shraddha Puja and Mahapadhyaya. On 13th day, social mela, like a Terahi party, Terahi food get together is done, makes a closure of marooning. Now it is closed. Everything is now over. From day 1 to day 12, everything is over. And return to the social life, family, hosts, relatives, receive support. Everybody comes, get the food together, and this kind of things are taken. So emotional and social meaning of the Terahi, this is important. Now I am bringing our traditional steps, all these steps traditional, to the modern psychological support. It provides a structure and daily focus in early life. It allows expression of loss through symbolic action. It promotes healing through ritual and repetitions. What is the social and cultural role? This is the psychological role I have discussed. Terahi brings the family and community together. Affirms shared marooning and solidarity. Whole family is gathered for most of the activities, and society is gathered for the Terahi Brahmana Bhoj. So this kind of shared marooning and solidarity. Publicly honor the deceased one. You do a puja for that person who has died by all your relatives and friends together. Helps transition from sorrow to acceptance. This is the emotional and social meaning of Terahi in the scientific language. The key takeaway is Terahi is not just a ritual, it is a journey from shock to support, from marooning to meaning. This is the takeaway message. And mapping Hindu marooning rituals to grief communication tools. But this is the underlying purpose, communication tools, how to apply. And this is the traditional daily tree ritual, 10-day head shaving, offering Mahapatra Pandit, 13-day social gathering, 7-day Bhagavad Katha. These are the activities which are done, and underlying purpose. Everything has a purpose. Continue bonds with the disease, symbol of loss, detachment from shared grief, nourishing the soul, and counting relationship, social reintegration, public closure, spiritual reflection, inner peace, and shared marooning, daily emotional support. So community tools, legacy and building versus remembrance, this too. Normalize grief reactions from nurse, meaning-centered counseling, dignity therapy, the 13-day, external communication and narrative therapy, but Srimad Bhagavat, listening, and nurse tool for daily emotional support. So these are the things which we do, and how to apply. Encourage family to honor our loved one's memory in simple. Use understand and normalize techniques. This help make loss visible and shared. Help families explore meaning. What would you loved one have appreciate about today's offering? This is the offering, Mahapatra offering. The loved things are given to as a donation. Create space for community support. Validate importance of collective ritual. This is the Brahmana Bhoj on 13th day last when the society is gathered together, all relatives together. Ask what stories from the Katha brought comfort. Facilitate life review or spiritual dialogue. In the Bhagavad, a lot of spiritual things are given. Family has listened it for 7 days. Now you ask them what you have learned from that, so that their mental agony, which was earlier with the patient, now has come towards the God. That shift has come. So name emotions and explore fear. So connecting with the Hindu marooning rituals with professional modern palliative care, grief support like nurse and school. The goal is to give an understanding that traditional grief rituals are deeply therapeutic. Modern language for ancient wisdom helps the students to appreciate how the traditional culture knowledge can be bridged with compassionate practice. So, grief support tools used, I told you, these are the tools, modern tools: nurse, spike, reliever, dignity therapy, remembrance practices. These all uh, these tools guide healthcare providers in supporting families before and after death across it. The key elements I told you: the nurse understand, respect, support, and explore. Spike, setting, perception, invitation, knowledge, emotion, and strategy. Reliever, rapport, empathy, listen, inquire, explore, values, encourage hope, and refer. This is the reliever. Spiritual and existential distress. Dignity therapy, life review, legacy, build sharing values, the katha and all these things. Remembrance, creating space for rituals, storytelling, and shared reflection, the honoring the dead. These are the tools. Mapping Hindu rituals, I told you, daily trees, these are the activities, and these are the encouraged. So from rituals, Hindu, observe first, speak second, understand the ritual's emotional role before giving advice. Number two, use the family's language, local language. Speak in terms of Atma Santi, Sanskar, Shraddha, to connect. Honor silence. Sometimes your quiet presence during the katha or terahi is the most powerful support. Involve spiritual leaders. Work alongside family priests and elders. They are essential grief facilitators. And finally, ask reflective questions. What part of the rituals help you feel connected? What do you want your children to remember about this time? With these things, reflective questions you can ask. Have you ever witnessed grief in parents' family, in patient family, or in your own? What did that moment feel like for you? Encourage honesty, but allow listen if needed. What scares you most about dealing with grieving family? Normalize fear and disconnect as learning. What do you know? What do you think helps people feel supported in their grief, not just told what to do? Start identifying emotional intelligence over clinical intervention. When you imagine a family member crying in front of you, what would you say or not say? Move forward, compassionate presence over giving advice, over giving advice. So the take-home message is, what does grief look like? Ask a student to write one or two words that comes to mind when they hear the word grief. Collect them on a board or a flip chart to share the screen. Discuss how diverse and complex an experiences of grief is. This is the thing. So grief is a natural response to loss, but it is not the same for everyone. It varies from individual to individual. Emphasizes the individuality of the grief. No two people, even in the same family, will grieve the same way. You have to identify, you have to assess the degree of grief, and you have to make a plan accordingly. In palliative care, we do not just treat the symptom. We support the life and we support the living. Set the tone that supporting death with dignity includes supporting grief before and after. Being present with someone in grief is not about fixing their pain, but witnessing it. Help students shift from a fixer mindset to a companion mindset. This is the takeaway message of this. class. With this, I end my class. Thank you very much.